everyone. Hope you're all doing good. Guys, we have started off the KickStart series for people whoever is going to prepare there for MSCOG Part 2. But we have chosen the topics very carefully, which could be useful for even Part 1 and Part 2 and Part 3 aspirants. Okay. So my topic is all about NHS training. And most of you know me already. So I'm Dr. Sowmya, who is the CEO and Chief Mentor at StudyMedic. With this KickStart series, our main aim is to make sure that your preparation is smooth and easy. We have picked up one topic so that your preparation when that particular topic becomes awesome and you understand the tips and tricks of that particular module. So basically, to start with, please remember, as you all know, whether you are taking Part 1, Part 2, or Part 3, the syllabus is voluminous and probably you have a lot of other commitments as well. So when you start off, you might not have a happy beginning, but be persistent and do your bit every day. Every day you have to show up to do your bit so that makes the journey beautiful, and definitely it makes you a better and a refined clinician by the end of it. So that's what the success quote goes like. Your story may not have such a happy beginning, but that does not make who you are. It is the rest of who you choose to be. So what you want yourself to be out of this journey would be what it would be deciding. So let's kick on to the topics. So clinical governance is one of a very important module because it is completely based on the NHS or the UK system. So we need to be very thorough with a couple of things like the consenting part and the ethics, and also the revalidation, how it goes, incident reporting, risk management, and the hierarchy with which it is going. So that's what I'm going to cover today, two things: NHS training and work-based placed assessments, because the hierarchies is something which you need to know to understand the whole of the system. So how would you go about reading this module is, first thing is you have to watch a couple of videos if you wish. About the RCOG has got a beautiful website which has a lot of things inbuilt. So if you go through those resources, it is beautiful. And also they have got a Vimeo videos which can help you to go through and understand the system. And there is a lot of clinical governance papers which talks about from audit, risk management, what is incident reporting, everything. There are around 10 to 12 papers which can help. And also there is a huge consent forms which are for both ops and gynae before you explain to the patient the procedure, how to go about. So if you go through them, that could be really, really helpful. Now, let's start with the training schedule, the back to basics thing. Okay. So basically, when after the undergraduation, they enter the foundation year training, which they will be doing rotation in all the departments. That is 2 years, there will be foundation year training, which would happen. And including women's health module. That means they have to rotate everywhere, and then they get NTN, that is National Trainee Number. And once they choose OBG as their specialty, then there will be a basic training which goes like these many years. So first year is ST1, second year is ST2, which is a basic training. Remember, to move from ST2 to ST3 Part 1 MSCOG, they must have passed the trainees. Then they go for 4 and 5, and 3, 4, 5 is again intermediate training. And to move from 5 to 6, they must have cleared Part 2 MSCOG. So ideally, before they move from 5 to 6, all the 3 parts of MSCOG, even Part 2 and Part 3 should be covered so that they can move to the advanced training of 6 and 7, where they go for advanced training specialty modules, or they can choose the subspecialty things and they become CCTs, that is certification of completion of training, that they become consultants. So ideally, the basic training is first and second, intermediate is 3, 4, 5, and advanced is 6 and 7. This is the basic structure of the training schedule. And who will be the educators who will be accompanying these trainees? So the most important thing, see, there are different tiers of educators. So the educational supervisor comes as tier 3. Tier 4, you have college tutor, training TPDs, that is training program director, director of medical education, and the highest tier would be the dean and the head of the school or the associate dean. So these, I have covered the most important educators' roles and responsibilities and in the coming slides. And remember, educational supervisor is the one point of contact for a trainee who will be helping him or her throughout the training. So what is the main responsibility of these important educators? Educational supervisors, they have to carry out the required number of assessments, make sure that they sign off the e-portfolio. E-portfolio is the profile of a trainee, which is a soft copy, which if you actually go through the website, you can go through that. They will have a login and password in which all the training would be assessed, all the forms would be updated. So that is a system which is followed so that everybody who would want to have a look at the trainee would be covered. And educational supervisor is the main person who will be going ahead and helping these students from induction to the appraisal of how their training is going, and making sure that it is the students' work or the candidates' own work they would be confirming. When we come to the medical director, they will be having a clinical advice for the board, but they are the main bridging gap between the medical staff and the board. When you come to the clinical directors, they actually see both administrative and legal aspect, but they are the ones in case of emergencies like the COVID or any pandemics, they are the ones who will be taking care of their trust to make sure that the best of the quality is delivered. And they also make sure that all the policies and guidelines are updated and followed as well. Okay. Now, when you, because you might have heard that consultants play a vital role, especially when you come to the Part 3 MSUG, you must remember, because you will all be giving exams as an overseas candidate, if at all, if you're giving, you must remember consultants have to be called in at many times, okay? So that is the reason I've initiated this slide to understand when you have to be calling. First and foremost, you need to be a safe doctor, irrespective of the grade in which you are. You need to be calling for help. And these are the things which is a consultant must attend. Okay, for example, any emergencies, ops or gynae, where there is an estimated blood loss of more than 1.5 and it is still ongoing. And obstetrics, they have given a list of the things like trial of instrumental delivery, twins, and if it is a preterm cesarean, or malposition or malpresentations if you are doing a cesarean section, breach, or 3rd degree and 4th degree perineal tear, and difficult cesareans like BMI more than 40 or cesarean section at full dilatation. And if you go for the gynec thing, there are a lot of procedures. Of course, I have added a few, like any difficult surgeries you expect, even the diagnostic lab, if at all, if it is a multiple additions are there, or probably if at all, if you think that you, for example, abdominal hysterectomy or the laparoscopic hysterectomy, or you encounter an injury, obviously those emergencies consultant must be called in. So if before you get signed off, okay, even after you getting signed off for a particular procedure, emergencies and wherever you suspect a problem, your consultant must be present. And remember to be the safe doctor for your exam purpose. Whenever they ask questions, whenever there is a clinical scenario, always think whether you can handle this or you need to involve the seniors. Next, the whole of the curriculum is based on capabilities in practice. So you could see it is not very important from the exam point of view, but it's important for you guys to understand what capabilities in practice is required. So that is the reason I've just put the critical progression of from ST1 to ST7. So you need to know the CIP 9, 10, 11, and 12, and what is the grading as well. Okay. So this is very important because throughout the curriculum, this will be tested on. Now, let's talk about matrix progression, what each trainee would be doing. Okay. So as you all know, ST1 and ST2 is a basic training. And ST3, 4, 5 is an intermediate, 6 and 7 is an advanced training. So clinical skills. One is the learning phase. The other one, probably there is a lot of academics to be followed up. Like they have to be giving the exams, they have to be reading the guidelines. The other thing is the clinical skills. So who will be the on-calls? So the basic trainees will be the first on-call. And then from 3, 4, and 5, they can become the second on-call. And if you could see, ST6 and ST7, because they are advanced trainees, they could be kept as third on-call whenever they have probably opportunities. And remember, as I mentioned before, Part 1 MSUG should be passed by ST once they have to move from basic to intermediate, and intermediate to advanced, they should have passed Part 2 and Part 3 both. Okay. And these are the number of assessments. Okay, I would be talking in a while. What are the OSATs which they need to be doing? Are the probably CBDs and mini-KEX, how much they have to be doing? If you could just have a look, for example, ST2, They must have a 3 summative OSATs of basic cesarean section, ventouse, forceps, which are simple and straightforward, perineal repair, insertion of IU's intrauterine system or IUCD. So like that, each of them have got a matrix, okay, and these things must be filled before they go for annual review of the competencies. So one is the OSATs, which is the clinical one, and there is an examination which they have to be following, and there are also derogated competencies which they need to know, cover, and then comes the assessment. If you could see the assessments, for example, CBDs, reflective practice, not it starts from ST1 to ST7. I'll be talking about this as well. And training evaluation form has to be from 2023. Each training year they have to be filling in. Do not worry, I'll cover them as well. And TO2, there's a multi-source feedback forms have to be like TON you will be collecting, and it will become TO2 score as well. And also, along with all this, to develop the trainee holistically, you will have a lot of recommended courses. And to go for advanced trainee specialty course, they must pass their part 2 and part 3. Then only they'll be getting an access for ATSM. Okay. Just to give a hint of how many minimal assessments they need to be doing. So I'm not talking about the OSATs. For the formative ones, minimum remains 8, but sometimes it could depend upon their portfolios. Okay. Okay. So guys, why am I trying to tell all this is because this could be part of your EMQs, SBAs. And if you understand the whole of the system, how it works, the examination becomes easy. So how does the work-based placed assessment is done? So basically they would be, you already know the knowledge and know how to do, but how you are performing, okay, and how you will act during a couple of situations is what the workplace-based assessments would be done with. And any trainee who joins the training program, you need to remember that they have to have an induction meeting and an appraisal meeting. What is an induction meeting? Induction meeting is nothing but giving an overall helicopter view of the system, which would be done by educational supervisor, who is the important point of contact for the trainee, and it has to be done within 2 weeks. And they would be reviewing, telling about the logbook, current competencies, and they would be achieving the goals for the coming months or the year. And after the induction, then you will be meeting your educational supervisor at twice. One is at 4 months, the other one is at 8 months, to make sure that you are running well in the year. Please remember, you need to be submitting for ARCPs happens at the end of every year. So you need to be making sure that you are running on the track, and all the discussions would be put in the e-portfolio. Now, when it comes to the assessments part, okay, so how it goes, okay. So workplace based assessments, there will be things like the CBDs, how it goes, basically, what are the different types of assessments you have. There are 2 things. One is formative, where it is a friendly feedback, okay, where you are actually doing or observing or assisting the procedures also. Even the OSATs, you have a friendly feedback, which is formative. Next is the summative, where you are supposed to be doing procedures under observation, under supervision. You will be observing, which is a formative, similar to the formative one, but you will be signposting when you're coming for that, under observation, under supervision, and you will be doing independently. And the other ones which we have got is CBDs, OSATs, and MEDIC-MRCOG. So I'm going to talk about them. So very, very important, guys, you need to know what are the different types of assessments and where it is utilized. Okay. So as I mentioned before, formatives help the trainees to prepare better, because those are the ones, the smaller procedures and the smaller ones, like for example, from consent taking to the examination part, all would be covered in these formative assessments. And this is a very important SBS, guys. So if you could see, for example, MEDIC-MRCOG, that is mini clinical evaluation exercise, where you will be, for example, you examine or you take a consent. So whoever has been signing off this would be looking at you and give you friendly feedback how it would happen. I've added a couple of forms. I'll show that as well. Case-based discussion is you manage the case. with your senior, with your junior colleagues, and you come back and discuss with your consultant how it went. It could be shoulder dystocia, it could be PPH, it could be heavy menstrual bleeding. Then when you come to the technical skills, take it from the simple episiotomy till the complicated lap hysterectomy if you want to do. You need to first do a formative ones. Formative ones is basically, again, you are actually doing, whenever you're doing the procedure, you're given the friendly feedback, how to go about and how to improve. Then comes once you have signed off formative and you are competent enough. Okay, you have signed multiple formatives and you are competent enough that you can do these procedures on your own, then you go for summative. So that is what, then you will have a count, because formatives you can do as many as possible. Once you come to the summative, then there would be a decision given like pass or fail. Obviously, it is not in those terms, to simplify. So whether you are competent or whether you are working towards competence. So that is the reason you have to, the trainees must take as many formatives as possible before they go for summative. Then once you have done with all of this, okay, then comes your yearly ARCPs, which is a summative one, where you are given different outcomes, which will help you to decide whether you can progress to the next year or stay in the same year. And it is yearly performance of the whole of the trainees. And appraisal could be formative for trainees who are meeting their educational supervisors. But this appraisal is summative for the consultants, because even for the consultants, there is an summative appraisal, so that we know that, I mean, the system runs smoothly, even considering the competencies of the consultant. Revalidation. Revalidation is you have to provide to the GMC once in 5 years. That's a summative assessment where you are proving to the GMC that you are fit to practice as a doctor. Now, a bit about the form so that you understand what we are talking about. Case-based discussions, okay, it could be in ops and it could be gynae. These are all the soft copies which you would be filling in, and these are easily available in the college website. So you can see this, the trainee name, the clinical setting has to be filled in, what problem category, focus on the clinical encounter, and what is the complexity of the case. This would be ticked by your assessor. And see, they have already mentioned this is a formative tool to give a specific constructive feedback and areas to what are the areas you will be considering. There's a record keeping, assessment, investigation, management, based on whatever you have decided. These are the basic instructions for the assessor. And you can see the feedback. You have to be telling them what went well for the trainee, whoever has done formative assessment, what could have gone better. And it doesn't end there. If they haven't done something well, you have to go for the learning plan as well. Okay, so for example, in the shoulder dystocia, when they explain, they forgot a couple of things, the minute things are probably they missed on, they didn't do the maneuvers correctly. So you would be putting a learning plan of simulation training, for a simple example like that. And then the trainee would be signing and the trainer will sign here. And what is the trainee's reflection on this? It is not only the trainer who will be signing, it is also the trainee who would put across his or her thoughts that how it went well and how they could have done better. And it's a self-reflection, which is a very important thing. When you move to the OSATs, there are two things. One is formative, the other one is summative. Okay. So in the formative ones, which is also called supervised learning event, again, OSATS is objective structured assessment of technical skills. So here you are again giving a friendly feedback. So, but one thing you guys must remember, there are a couple of things about OSATS. One, when somebody comes for the OSAT, they have to signpost that before they start the procedure, whether it is formative or summative. Second thing, that is what is called signposting. So you cannot change formative to summative, summative to formative afterwards. Third thing, a person, whoever has been signed off, even if you are ST3, ST4, ST5, if you have been signed off for a particular procedure, for example, episiotomy, you have been signed off, you can sign OSATs for your junior trainee. And the fourth important thing, there should be 3 different assessors for OSATs, and one of them should be your consultant. Okay, so a couple of important points about the OSATs. And again, you can see this is supervised learning event, so it's a formative tool. Okay, so there is no overall judgment in this formative tool because you're going to tell them what went well, and what they can improve on. And also there are suggestions which are to be filled in, like you have to consider as a trainer, starting from equipment to technical ability, to do not forget the most important soft skills, communication with many of the people, and like your staff, your senior, junior colleagues, and also how well you are delegating that task. And also if problems encountered, how did you go, documentation and safety considerations. All these things are considered for a trainee. Like the trainer would be looking at all these points. And again, feedback, what went well, okay, what could have gone better, and remember the learning plan. Learning plans come only in the formative assessments, and trainee signature and trainer signature. Again, both have to be signing. Now, when you move to summative, it is, remember that was supervised learning event, and this will be assessment of performance. Here, again, after filling the initial demographic and details and all what complexity of the case, you can see here, it's a mandatory summative tool, which is designed for judgment of the surgical competency and specific constructive feedback to be given. Make sure that at no point a trainee to be bullied, or you have to, whatever you are going to tell them, you have to put it across in a point for them as constructive feedback so that they would be able to learn. Again, if you could see here, for example, once they have done the procedure, then there are only two things which you would be doing. One is this is observed competently, or they are or they are working towards competence. Working towards competences, they are still not very good at that. But if observed competently means they will be signed off for that particular procedure of that summative OSATs. Again, you will be consider all this. And if something has not gone better, obviously you have to put the learning plan, and you have to consider the similar ones what we considered for the formative OSATs. Why am I even telling all this is because it gives a lot of idea when you look into the forms, how it goes, especially for the overseas candidates. This is very important, and you would be getting the task in part 3 also. So if you understand now the basics are strong, then things would be easier. Now, when you move to the NOTS, NOTS is nothing but the non-technical skills for the surgeons, which are a softer skills. So you remember NOTS has got a, probably I would say the more importance in the e-portfolios in the last few years. So what are the things they would be considering is, as an overall thing, it is not about the technique or the knowledge what you have got, but how you have a step-up approach or the helicopter view, like the situational awareness, gathering information, understanding, projecting, and anticipating when something comes in, because you are a leader of that particular board. Probably once you are an ST5, you are supposed to be managing many things independently, or you are a second on call even at an intermediate training like 3 and 4. And decisions making. So when you can take an independent decisions, when you need to be calling your consultant, you need to be very, very clear about, and whom all you will be calling for the teamwork. And see, always remember, communication and bridging the gaps and calling for help is very, very, very vital. And you have to coordinate the team activities and showing the leadership skills. For example, in places like the labor ward or the ER, whenever you have been called, how you will be coping up with pressure, how you allocate the duties. At the same time, making sure you're a safe doctor. Now, when you come to the ARCP outcomes, ARCP outcomes, you know that yearly they have to submit, because it is a summative one which decides whether the trainee can move from 1 year to another year. So outcome 1 is nothing but it is a good outcome. So where they have submitted all the documents and the assessors ARCP panel is happy and they can good to proceed to the next level. 2 is they are good, but couple of procedures might need target training, like probably manual removal of the placenta, or couple of the procedures which they need a targeted training. Then you can shift them to they can proceed to the next year. They don't need a extension of the training, but they need a target training. That is what outcome 2 is all about. Next. Sorry, guys. Next comes outcome 3. Outcome 3 is there is a deficiencies in training which need additional training. For example, I told you before they move from 2 to 3, they should have passed their MRCOG Part 1. If somebody is clinically very, very competent also, they have got all their assessments perfect, but they haven't passed the MRCOG Part 1, so they would remain in trainee ST2 level only, because they have to clear these Part 1 and Part 2 and Part 3, and then only they will be moving to the next year. So as you know, the exams come at stipulated time. So obviously either in the Jan or July, they need to finish, and then only they will be moving to the next year. So that's the reason they will have extension of training. So outcome 1, good. Outcome 2, deficiencies, but they can proceed with targeted training. Outcome 3, there is deficiencies and they need an extension of training. Outcome 4 is one of the worst outcome which a no trainee should be getting, and they would be released from the training. So due to trouble incompetencies or repeated complaints or whatever the things, but the maximum time duration would be given for them to maximum chances would be given before the release from the training. Outcome 5, ARCP panel cannot comment as the documents are not submitted or the incomplete ones. Outcome 6 is one of the final outcome which they get, which is satisfactory, and they can proceed to certification of completion of training so that they can become the consultant. Why am I talking about this is, guys, these are a very important single best answer at the EMQs. Know your ARCP outcomes very, very well. Okay. Now, there are a couple of things which I wanted to put the stress on. As you guys know, if they do not clear the exams, for example, ST2 didn't clear Part 1, so outcome 3, that means extension of the training. Here, somebody has demonstrated good formative OSATS, but he or she is unable to do the summative OSATS because of less exposure. Then you move to them to the next year, but with a targeted training. That is outcome 2. What is TON forms? This is a multi-source feedback form. Like before each ARCP, the trainee has to take 10 team observation forms. That is team observation form 1 from all 10 different colleagues. Could be junior colleagues, senior colleague, porters, staff nurse, midwives, coordinators. You have to get from them and submit to the educational supervisor. Then the educational supervisor would add up all those and calculate the team observation 2 form. The college gives too much importance to the growth of a holistic trainee. So even if you're very good at skills, but if your behavior towards your colleagues is not correct, then you'll be getting poor TO2 score. That means to say you will have an extension of the training. So it's very, very vital and important. The last one, which we already discussed, is an outcome 6. Once you get outcome 6, you can become consultants. These are all, again, important questions which would be asked. I wanted to draw your attention to one of the most important things. Work-based assessments, see, 2 and 3, it is when some mistake is done only once. For example, they do not attend the calls once in a while, then they get 2. But if, obviously that is not accepted, I'm just giving an example, but when it becomes repeated, then it becomes outcome 3. For example, you can see that number of CDs are sufficient, the CBDs and mini-KECs, but the quality of the timing is of concern. But here, like inappropriate timing and quality, persistent inappropriate and quality. So whenever something gets repeated, they do get outcome 3 so that they have to repeat that the whole year. Okay. And obviously, ARCP panel is the final decision to give the outcome. Okay. So this is what I was trying to tell you guys. And again, as I mentioned about before, the additional courses, they have to attend very, very important courses. Let it be CTG training or probably the basic practical skill course or prompt. They have a stipulated time duration before which they have to complete. For example, if somebody doesn't complete prompt course before ST2, then they will remain in ST2 only. They cannot move to ST3. Okay, these are the very important, I think, things which can help to keep the training in check. And team observation forms, as I said, major or recurrent issues noted, they would be given outcome 3. Now, I hope the ARCP outcomes and how it is calculated, that would be easier for you guys. reflective practice. What do you mean by reflective practice? Because it's very, very important to have an inner reflection of how my training is going, right? So this is what they would be engaging the trainees. There is a reflective practice forms. If you wish, you can go through the website to see what it is, like clinical situations, performances, how they are doing. So it's inner reflection, which they have to be going ahead and doing. And it's a very important thing. For example, when you come across a case, how well you managed, what you could have done better would be really awesome. Then there is something called training evaluation form, which you saw in the matric progression, where the trainees are enabled to give the feedback for the college, how it is doing and how they can improve the quality. Basically, this is to keep the quality check and also make sure that the college gets the inputs from the trainees as well. And a bit about the clinical team, because you need to understand how the system works. So during the office hours, like in the morning hours, make sure that very, 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 very important about when you start your shifts, you are supposed to take a safe handover. Okay. Safe handover is the main key for the patient safety. And obviously, there will be indirect and the direct supervision from the consultants available, and you will have a plenty of staff in the morning. But when it comes to the on-call team, okay, so there will be a consultant who will be usually available within 20 minutes of the call. And there will be registrars, there will be, like your midwives and the labor ward coordinators. So you need to know your team very well, because so that you will be managing the whole scenario in the on-call team or in the night shift. You need to be knowing. And these are the people who will be able to come on call for you as well. There will be one registrar and one anesthetist. Obviously, consultant anesthetist will be on call as well, and consultant on call from home, and probably there will be recent on call resident as well. So this will be the second on call. Whenever in need, they would be calling. So guys, what I have done in this is not to talk too much about how to interpret the EMQs, how to interpret the SPAs, but to give a very probably panoramic view of about a training and the assessments. Hope this was useful. Do not forget to share, subscribe, and like. You can leave the comments in below this video for us to understand how it has helped, because I thought this is one topic for the overseas candidates which could add a lot of stress during the preparation. So I thought this could be the best way to take away your stress and to help you in preparing. Hope this is useful. Don't forget to drop the feedbacks and like and share and subscribe. Thank you, guys. Thank you so much.